Traditional Complementary Medicine, TCM, textbook of JMMT compiled by Saburo Sasada, Ph.D. of Acupuncture, SNESVI, Tsukuba University, Japan. Sponsored by JICA. August 2013. Contents: Part I. General Introduction. Lesson 1. The Seminar Concept of JMMT. Lesson 2. Talking Hands, How to Develop Your Healing Power. Lesson 3. Mind-Body Unity. Lesson 4. Qigong Exercise Part 2. Traditional Chinese Medicine, TCM, Lesson 5. Yin-Yang Theory. Lesson 6. 5 Elements Theory. Lesson 7. Qi and Blood. Lesson 8. Cause of Disease, Pathogenic Factors. Lesson 9. Meridians and Organs. Lesson 10. San-Yin-San-Yang Relations. Part 3. Meridians and Points. Lesson 11. Kinesiology and Meridians. 1. Lesson 12. Kinesiology and Meridians. 2. Lesson 13. Kinesiology and Meridians. 3. Lesson 14. Kinesiology and Meridians. 4. Lesson 15. Kinesiology and Meridians. 5. Lesson 16. Kinesiology and Meridians. 6. Lesson 17. Kinesiology and Meridians. 7. Lesson 18. Major Meridian Points on Arms and Legs. Lesson 19. Major Meridian Points on the Back. 1. Lesson 20. Major Meridian Points on the Back. 2. Lesson 21. Major Meridian Points, Anterior Aspect. 1. Lesson 22. Major Meridian Points, Anterior Aspect. 2. The End of Contents. Part I. General Introduction. Lesson 1. The Seminar Concept of JMMT. JMMT stands for Japanese Medical Manual Therapy. JMMT is basically developed in Japan and modified by combining other countries' methods from China, Thailand, and Western scientific methods. The following 5 items are specialty of JMMT. 1. Talking Healing Hands. The therapist concentrates with his/her hands to communicate with the client's ailment part directly. Even without talking, the excellent therapist's talking hands can heal the symptoms. 2. Mind-Body Unity. Mind affects the body, and body affects the mind. The therapy approach is done not only by the analytic microscopic way, but also approached by the holistic macroscopic way. In this concept, therapists should practice chakra/dantian breathing, deep abdominal breathing with good posture. 3. Non-oil massage. There is no need for the client to undress, and the therapist does pressure/kneading massage using a cotton cloth. 4. Therapy mechanism. Unhealthy bodies have imbalance in their body structural and/or functional. JMMT therapists will check the imbalance and make balance. This is the way of strengthening natural healing power which the human body originally possessing. It covers various functional diseases such as pain, stiff, numbness, unidentified discomfort, etc., but it doesn't cover structural, infectious diseases or traumatic acute stages. 5. Promoting Vocational Independence for/of the Blind. This course is run by SNESVI of Tsukuba Univ, NAB, and NIVH, and sponsored by JICA. The project aims at better vocational independence and empowerment of the visually challenged in India. Lesson 2. Talking Hands, How to Develop Your Healing Power. 1. Whenever you notice, keep good posture in sitting position and try imaging as follows. The skill to veracity, swaying, and make good balance between R and L. B. GV20. Image your GV20 is pulled towards ceiling, just above your head. C. The second chakra, gravity point, vaguely imaging, not strong. D. Abdominal breathing. Exhale, breathe out, slowly/long, and inhale, breathe in, naturally. Remarks. Early in the morning is the best timing, because the air is cleaner. 2. Where? Find any place you can breathe fresh air. 3. Who and what? Imagine your healing power comes out from the chakra, and exhale from your palm. Remarks. The healing power is equal to the vital energy, and the vital energy is stored at the chakra, and circulates whole body. Lesson 3. Mind-Body Unity, Analytic Approach versus Holistic Approach. The mind controls the body, and the body also controls its mind. So then, how to control our mind by our body is the key point of this chapter. Let us focus on breathing. 1. Breathing is done by voluntarily and also involuntarily. That means breathing involves the somatic nervous system and autonomic nervous system. 2. There are relevant skeletal muscles and smooth muscles. Those include the diaphragm, intercostal, sternomastoid, scalenus, rectum abdominis, oblique, smooth muscle at bronchus, etc. 3. Breathing has a rhythm like exhale and inhale. Slow/leisurely exhalation strengthens parasympathetic nerve and inhalation strengthens sympathetic nerve. 4. Nervous control of breathing is done by a respiratory center in the lowest part of the brainstem, which receives stimulation from the vagus nerve. 5. Abdominal breathing induces serotonin secretion in our brain and makes us relax. 6. Abdominal breathing is best done by keeping good posture. 7. Also, abdominal breathing is done by having an image of gravity center, the second chakra, CV4. Lesson 4. Qigong Exercise 1. Introduction. Qigong exercise aims at maintaining good health by everybody and reinforcing healing power as a therapist. It is not a muscle strengthening exercise, but is a muscle relaxation exercise with good breathing and good posture. First, you have to learn static Qigong exercise, and then step into kinetic Qigong exercise later as mentioned below. 2. Static Qigong. Please establish the best breathing, posture, and relaxation. 1. Good posture. A standing foot stances about 20 centimeters width, and the extended line of the third toes make parallel. The knee joint should be a little flexed. The straight extended knee is locked. You should relax without the locking. See the images. GV20. Top of the head is pulled toward ceiling, just above your head. 2. Good breathing. This also accomplished by imaging. Inhale air by nose and come down at Dantian, gravity point, the second chakra, and store for a while. The exhalation should be done slowly, smoothly, and in a relaxed way. 3. Relaxation. Please image Dantian, gravity point, the second chakra. You can relax whole body naturally. 3. Kinetic Qigong. There are 4 steps as follows. Whole exercises should be done in a relaxing manner with abdominal, chakra breathing. 1. Swinging arms. Both arms are going to swing relaxingly. The image is like swinging pendulums of grandfather clock. Swinging front with supination, and swinging back with pronation. Scapulae should be moved like abduction and adduction more than 20 times. Swinging is preferable. 2. Twisting knees. Slightly flexed knees are going to turn right and left rhythmically, and the knee swings in a non-stop way. The upper body is going to swing automatically. Both arms move around and bump into your sides. More than 20 times rotating/swinging is preferable. 3. Hula hoop. Finger of both hands are closed at the back of sacrum in a relaxed way. The pelvis is going to move around making large oval shape. You should make a beautiful smooth non-stop movement. Clockwise movement 4 to 5 times, and change to opposite direction and circle movement the same number of times. 4. Swinging legs. With one hand holding a handrail, pillar, or wall, the leg on the other is going to swing front and back in a relaxed way. The arm on the same side is also going to swing opposite way of the leg, making a dynamic movement. Do this on one side 20 times, and then change to the other leg and swing the same number of times. Remarks. 1. In case of pain, if you feel pain while doing these movements, the method is not being done correctly. You should use smaller movements that do not cause pain, and then you can continue. If the smaller movement causes you pain, you should stop the exercise. 2. Efficacy of centrifugal force. Relaxing swinging limbs allows you to feel centrifugal force. The major joint capsules of limbs are stretched, and then inside pressure is decreased. This is good for relaxing the joints and metabolism. Part 2. Traditional Chinese Medicine, TCM. Lesson 5. Yin-Yang Theory 1. Introduction. Traditional Chinese medicine, TCM, has been practiced in China for more than 2,000 years, and it was introduced to Japan around 7th century. The human body is a part of nature, and thus harmony must be maintained not only within body functions, but also maintained between the body and nature. History. A silk manuscript discovered in 1972 from a Han Dynasty tomb dated at 186 BC shows pictures of mind-body exercise. Qigong. 2. Yin-Yang theory. The fundamental concepts of TCM are yin-yang and the five-element theory. According to TCM, the whole universe is made up of the unity of two opposite components of yin and yang. 1. Yin represents things relatively inactive, descending, internal, cold, and dark. 2. Yang represents things relatively active, ascending, external, hot, and bright. B. All symptoms of pathological change can be differentiated on the basis of yin and yang. However, the natures of yin and yang are not absolute, they are relative concepts. Yin and yang are interdependent, and can transform into each other. C. The equilibrium, good balance, of yin and yang ensures that the harmony of the body is maintained. A healthy person with no symptoms of illness is considered to have equilibrium between yin and yang. Table 1. Functions of yin-yang characters: yang up, sun, day, fire, heat, movement, exterior brightness, yin down, moon, night, water, cold, stillness, interior darkness. Table 2. Yin-yang and syndromes: yang-yin desire. For cold, drink and food desire. For hot, drink and food, fever, perspiration, hyperfunction. Chills or dislike to cold, hypofunction. Raised metabolic rate. Reduced metabolic rate. High temperature, sweat, increased gastric peristalsis, sympathetic hyperactivity. Low temperature, reduced perspiration, reduced gastric peristalsis, parasympathetic hyperactivity. Red or rosy complexion, pale complexion, yellow urine, clear urine. Lesson 6. Five Elements Theory 1. Introduction. The five elements theory developed in ancient China linked with yin-yang theory according to a holistic approach to understand the human and the environment. Big nature. It is a natural philosophy. The five elements are wood, fire, earth, metal, and water. Those five characters explain the whole universe, categorized into five elements. It explains not only nature, but also the functions of human body. The theory also explains the relationships between the human body and the external environment. In the five elements, the physiological and pathological relationships among the internal organs are also explained. The table below shows the basic classification of the five elements. 2. Promoting and dominating between five elements. A. Promoting means that one element promotes the other elements in the order of wood, fire, earth, metal, water, and then wood again. The order circles endlessly. For example, wood promotes fire, and fire promotes earth, etc., and water promotes wood. B. Dominating interaction means that wood dominates earth dominates water dominates fire dominates metal, and metal dominates wood. It is also circles seamlessly. Table. Classification of five elements: basic: wood, fire, earth, metal, water. Seasons: spring, summer, late summer, autumn, winter. Directions: east, south, middle, west, north. Weather: wind, summer. Heat, dampness, dryness, cold. Colors: green, red, yellow, white, black. Taste: sour, bitter, sweet, spicy, salty. Compact organs: liver, heart, spleen, lung, kidney. Hollow organs: gallbladder, small intestine, stomach, large intestine, bladder. Tissues: tendon, vessel, muscle, skin, bone. Sense organs: eye, tongue, mouth, nose, ear. Manifestations: nails, face, lips, body hair. Voices: shouting, laughing, singing, crying, moaning. Emotions: anger, joy, worry, grief, fear. Remarks. Each element represents an internal organ. For example, the liver is associated with wood, the heart with fire, the spleen with earth, the lung with metal, and the kidneys with water. Clinically, pathological changes occur if these dynamic balances are interrupted or destroyed. Lesson 7. Qi and blood. How does the human body physiologically maintain its vitality and health? By qi and blood. 1. Qi. A. What is qi? It is the vital energy, life force energy, and the essential substance for maintaining the health. B. The origins of qi. 1. Congenital qi, which is inherited from the parents and stored in kidney. 2. Acquired qi, which is obtained from the food eaten in spleen and air inhaled in lung. C. 5 functions of qi energy. 1. Promoting. 2. Warming. 3. Defending. 4. Governing. 5. Transforming. 2. Blood. A. Function. 1. Originates in the bone marrow, and is nourished by the food essence in stomach and intestines. 2. Managed by the heart, and cleaned by the liver, kidneys, and spleen. 3. Nourishes the organs and tissues. B. The relationship between Qi and blood. 1. Qi is classified as Yang and blood as Yin. 2. Qi generates blood. 3. Qi is the driving force of blood. 4. Blood is the mother of Qi. 5. Qi keeps blood flowing within the vessels. Remarks: body fluid A, such as saliva, tears, nasal discharge, intestinal secretions, sweat, semen, and urine. Body fluid can reach the skin and hair exteriorly, and the internal organs interiorly to moisten these organs and tissues. B. The function of body fluid is complicated. Lung regulates air passage, spleen transforms blood, and kidney dominates water metabolism, and the sex organs the reproductive system. Lesson 8. Cause of disease, pathogenic factors. 1. Introduction. There are some basic differences between medical science and TCM, which are regarding analytic approach and holistic approach. Let's focus on the pathogenic factors of TCM. 2. 3 categories of pathogenic factors: external, internal, and lifestyle. A. External, environmental factors: weather, wind, summer, heat, dampness, dryness, cold. Remarks: see document 009, the table of 5 elements. The natural normal environmental factors are not harm. B. Internal, emotional factors: emotions, anger, joy, worry, grief, fear. C. Regarding lifestyle: diet, sex, and fatigue, dietary life, sexual life, and tiredness. Remarks: 1. Keep a well-balanced lifestyle and not too much to do. 2. Other pathogenic factors, like trauma, are skipped because of having similarity in both medicines. 3. Specific examples of pathology: A. Wind, Yang pathogen, tends to invade the upper part of the body, changeable and movable. It is the leading cause of all factors. B. Summer heat, Yang pathogen, scorching, tends to rise and evacuate fluid and Qi. C. Dampness, Yin pathogen, tends to obstruct Qi activities and impairs spleen. The heavy and viscous pathogen. It attacks the lower part of the body and stays long as a chronic disease. It tends to exhaust the body fluid. D. Dryness, Yang pathogen, tends to flare up and to impair Qi and body fluid, apt to disturb the lung. E. Cold, Yin pathogen, tends to impair Yang Qi, obstructive, and cause of stiffness, cramp, and shrinking of muscles. Lesson 9. Meridians and organs. 1. Introduction. The 361 points are distributed along the meridians. The 14 meridians are divided into 2 groups as follows. A. Median lines belong to 8 extraordinary meridians. 1. CV, conception vessel, links with 6 yin meridians. 2. GV, governing vessel, links with 6 yang meridians. B. 12 meridians, related with internal organs, 6 yin and 6 yang. Yin meridians/organs. 3. Lu, lung, chest to thumbs. 4. SP, spleen, big toes to chest. 5. HT, heart, chest to small fingers. 6. KI, kidney, foot soles to chest. 7. PC, pericardium, chest to middle fingers. 8. LV, liver, big toes to chest. Yang meridians/organs. 9. Li, large intestine, index finger to face. 10. ST, stomach, face to second toes. 11. Qi, small intestine, small fingers to face. 12. BL, bladder, face to fifth toes. 13. TH, triple energizer, ring fingers to face. 14. GB, gallbladder, face to fourth toes. Remarks. 1. Triple energizers have functions of metabolism and immune system, and are divided into 3 parts in the body trunk. Upper part, above the diaphragm; middle part, the upper abdomen; and lower part, lower abdomen. 2. Pericardium, sharing the function of heart with HT meridian. 3. Similarities and differences between medical science and TCM. Although some of these physiological functions are similar to those in Western medicine, others are very different. For instance, the heart is said not only to control the blood circulation, but also to take charge of mind activities. The main function of the spleen is digestion, which is very different from its function in Western medicine. Meridians. Theory of the meridians describes the energy system of the body that deals with the travel and distribution of the chi. The meridians, or pathways, are the main trunks that run longitudinally and exteriorly within the body, whereas the collaterals, or networks, are the branches running vertically and horizontally throughout the body. There are 12 regular meridians and 8 extraordinary meridians. The meridians and collaterals relate to the Zangfu organs. The 361 points are distributed along the meridians and serve as both pathogenic signs of disorder and as loci for acupuncture treatments. Thus, the meridians regulate qi and blood, balance yin and yang, and keep the functions and activities of all parts of the body in harmony. The pathogenic factors of TCM can be classified into 3 categories: external, internal, and other, neither internal nor external. The 6 external factors are wind, cold, summer heat, dampness, dryness, and fire. Normally, they are natural environmental factors and are not harm. Lesson 10. San-yin-san-yang relations, connections of meridians and points. 1. Each yin and yang meridians are divided into 3. There are 3 yin and 3 yang meridians in the arm and the leg, and they are called san-yin-san-yang. Originally it was classified by sunny side level and shadow side level of the skin. In this context, each particular arm and leg meridians make a pair, which means having similar functions in the pair, and chi energy is connected between these pairs. A San-yang Li and St as Yangmen meridians, Shi and Bl as Tai Yang meridians, Te and Gb as Shao Yang meridians, B San-yin Lu and Sp, Tai Yin Ht, and Ki, Shao Yin Pc, and Lv. Chu Yin remarks, you can image a first name and family name of someone. Shi and Bl are their first name, and Tai Yang is their family name. 2. The connecting point. Some meridian points connect with other meridians as a junction, like Sp6 and Te8. A major connection points of 14 meridians: Sp6, 3-legged yin meridians; Te8, 3 yang arm meridians; Gv14, 3-arm yang and 3-legged yang meridians; Gv20, Bl and Lv. Be connection points of extraordinary meridians. The following shows pair of points and indications: Pc6 and Sp4, chest and upper stomach discomfort; Lu7 and Ki6, sore throat and coughing; Shi3 and Bl62, backside head and neck pain; Te5 and Gb41, side of the head and neck pain. Part 3. Meridians and Points. Lesson 11. Kinesiology and Meridians. 1. Introduction. The 12 meridians of 4 limbs can be described as chain of movement as a kinesiology. It may be easy to understand as men of today. Let's focus on stomach and spleen meridians, which are recognized as yang and yin relations. 2. Synergist, antagonist, and chain of movement. A dorsiflexion of ankle, tibialis anterior, extensor digitorum longus, and extensor hallucis longus. Synergist and antagonist of tibialis anterior, tibialis posterior. Beni extension, quadriceps, rectus femoris, and vastus medialis. See hip flexion, iliopsoas, and rectus femoris. 3. Stomach, yang, versus spleen, yin, meridians yin-yang relation, opposing and cooperating. 4. Roll of fascia. Both tibialis anterior and extensor digitorum longus link with fascia and attach to bones. The fascia has important role of the chain movement. Lesson 12. Kinesiology and Meridians. 1. Introduction. In this lesson, the chain of movement, kinematic chain, is applied on the arm to understand Li and Lu meridians, which are a pair of yin-yang couple. 2. Preparation. A. Abdominal breathing, image chakra. B. Good posture, image gravity line. 3. Li meridian. A. Landmark points of Li meridian. Li 1, Li 4 star, Li 11 star, Li 15, Li 18. B. Kinematic chain. Fascia, extensor carpi radialis, brachioradialis, deltoid, and sternomastoid. 4. Lu meridian. A. Landmark points: Lu 11, Lu 9, Lu 7 star, Lu 6 star, Lu 5 star, Lu 2 star, Lu 1 star. B. Kinematic chain. Fascia, flexor carpi radialis, brachialis, biceps, and pectoralis major. 5. Yin-yang relationship and synergist/antagonist. 6. Remarks Lu1, radial side of index finger. Lu11, radial side of thumb. Lu4, facial problems such as eye fatigue and toothache. Lu11, shoulder pain along the meridian line. Lu7, chronic bronchial problem. Lu6, acute bronchial/sore throat. Lu5, coughing by common cold. Lesson 13. Kinesiology and Meridians, 3.1. Introduction. This lesson is an additional study of ST and SP meridians as a supplement. 2. Preparation. Same as yesterday. A. Abdominal breathing, image chakra. B. Good posture, image gravity line. 3. Saint Meridian. A. Landmark points of ST meridian. Saint 45, Saint 44 star, Saint 41, Saint 39 star, Saint 38 star, Saint 37 star, Saint 36 star, Saint 31. B. Kinematic chain. Fascia, extensor digitorum longus, tibialis anterior, rectus femoris, and iliopsoas. 4. SP meridian. A. Landmark points SP1, SP3, SP4, SP6 star, SP9, SP12 star. B. Kinematic chain. Fascia, abductor hallucis, tibialis posterior, vastus medialis, and iliopsoas. 5. Yin-yang relationship and synergist/antagonist. 6. Remarks. Saint 45, lateral side of the second toe. Saint 44, lateral side of the second MP. Saint 41, lateral side of anterior tibialis at crease of foot dorsum. Saint 39, in the hollowing point when dorsiflexed. Saint 36, 1 inch lateral from bottom of tibial tuberosity. Saint 31, lateral edge of groin crease at rectum femoris. SP1, medial side of big toe. Saint 3, medial side of the first MP. Saint 4, 1 inch behind from Saint 3. Saint 6, 3 inch up from medial malleolus. Saint 9, under the knee and corner of tibia. Remarks. These SP points are effective to women's symptoms. Lesson 14. Kinesiology and Meridians, 4.1. Introduction. The study theme in this lesson is heart, HT, and small intestine, Chi, meridians which are yin-yang couple in the arm. 2. Preparation. Same as yesterday. A. Abdominal breathing, image chakra. B. Good posture, image gravity line. 3. HT meridian. A. Landmark points. HT9, HT7, HT3 star, and HT1 star. B. Kinematic chain. Fascia, flexor carpi ulnaris, caraca brachialis, short head of biceps, subscapularis, rhomboids, and all 4. Chi meridian. A. Landmark points. Chi1, Chi3, Chi4, Chi7 star, Chi8, Chi9, Chi10, and Chi11 star. B. Kinematic chain. Fascia, extensor carpi ulnaris, long head of triceps, infraspinatus, teres minor, and rhomboids. 5. Yin-yang relationship and synergist/antagonist. 6. Remarks. HT9, radial side of the small finger. HT3, cardiac problem. HT1, at axillary artery. Long pressure, forearm numbness. Chi1, ulnar side of the small finger. Chi3, headache, backside. Chi7, pain in scapular region. Chi9 to 11, shoulder joint pain. Lesson 15. Kinesiology and Meridians, 5.1. Introduction. The study theme in this lesson is bladder, BL, and kidney, KI, meridians which are yin-yang couple in the leg. 2. Preparation. Same as yesterday. A. Abdominal breathing, image chakra. B. Good posture, image gravity line. 3. BL meridian. A. Landmark points. BL 67, BL 62 star, BL 60, BL 40 star, BL 39, BL 37, BL 36 star. B. Kinematic chain. Fascia, dorsiflexor, everter, abductor of the foot, lateral head of gastrocnemius, soleus, biceps femoris, hamstrings, and gluteus maximus. 4. KI meridian. A. Landmark points. Key 1 star, Key 3, Key 6 star, Key 10. B. Kinematic chain. Fascia, flexors of sole, flexors of ankle, medial head of gastrocnemius, soleus, medial hamstrings, and iliopsoas. 5. Yin-yang relationship and synergist/antagonist 6. Remarks BL62, headache, backside, BL36-40, sciatica, low back pain. Key 1, fatigue of the leg. Key 6, cold feet and energy deficiency. Lesson 16. Kinesiology and meridians, 6.1. Introduction. The study theme in this lesson is pericardium, PC, and triple energizer, TE, meridians which are yin-yang couple in the arm. 2. Preparation. Same as yesterday. A. Abdominal breathing, image chakra. B. Good posture, image gravity line. 3. PC meridian. A. Landmark points PC 9, PC 8 star, PC 7, PC 6 star, PC 4 star, and PC 3. B. kinematic chain. Fascia, palmaris longus, 3 superficial flexors, biceps, and pectoralis major. 4. TE meridian. A. landmark points T 1, T 4, T 5 star, T 8 star, T 9 star, T 14 star, and T 15 star. B. kinematic chain. Fascia, extensor digitorum, triceps, deltoid, supraspinatus, and levator scapulae, neck trapezius. 5. Yin-yang relationship and synergist/antagonist 6. Remarks PC4, cardiac problem. PC6, 8, nervous disease, neurosis. PC9, radial side of middle finger. T1, ulnar side of ring finger. T5, fatigue of eye, stiff neck. T8, stiff neck. T9, stiff shoulder. Lesson 17. Kinesiology and meridians, 7.1. Introduction. The study theme in this lesson is gallbladder, GB, and liver, LV, meridians which are yin-yang couple in the leg. 2. Preparation. Same as yesterday. A. Abdominal breathing, image chakra. B. Good posture, image gravity line. 3. GB meridian. A. landmark points GB 44, GB 40 star, GB 37 star, GB 34 star, GB 31 star, GB 30 star, and GB 29 star. B. kinematic chain. Fascia, peroneus longus and peroneus brevis, tensor fasciae, and gluteus medius, piriformis. 4. LV meridian. A. landmark points LV1, LV2 star, LV3 star, and LV8. B. kinematic chain. Fascia, extensor hallucis longus, tibialis posterior, hippoductors, and iliopsoas. 5. Yin-yang relationship and synergist/antagonist 6. Remarks GB 29-40, sciatica regarding Bonnet test positive. GB 44, lateral side of the fourth toe. LV1, lateral side of the great toe. LV2-3, painful eye, red eye with congestion. Lesson 18. Major meridian points on arms and legs. The following 37 major points are a summary of what you have already learned. The grouping is arranged according to arm/leg and yang/yin. 1. The arm points say yang meridian, 8 points. Li 4, Li 11, Shi 7, Shi 11, Te 5, Te 8, Te 9, Te 14 B in meridian, 8 points. Lu 7, Lu 6, Lu 5, HT 3, HT 1, PC 8, PC 6, PC 4 2. The leg points say yang meridian, 14 points. Saint 39, Saint 36, Saint 31, BL 62, BL 40, BL 39, BL 37, BL 36, GB 40, GB 37, GB 34, GB 31, GB 30, GB 29 B in meridian, 7 points. SP 6, SP 12, Key 1, Key 6, Key 10, LV2, LV3. Lesson 19. Major meridian points on the back. 1. Showing major GV points, and same level other major points. GV, governing vessel. 1. Outline GV, governing vessel, starts from private part, and the chi energy goes up along posterior median, passing by top of the head, GV 20, and come down along anterior midline and end at the upper jaw inside of mouth. 2. Major points. The order is location and indications. 1. GV 3 star, between L4/5, for low back pain. Remarks, BL 25, 1.5 inch lateral. 2. GV4, tween L2/3, 4 weak body, impotence, erectile dysfunction, ed. Remarks. BL23, 1.5 inch lateral. 3, GV9, tween T7/8, for coughing and phlegm. Remarks. BL17, 1.5 inch lateral. 4, GV12, tween T3/4, for neurosis, coughing and phlegm. Remarks. BL13, 1.5 inch lateral. 5, GV14 star, tween C7/T1, for common cold, chronic stiff neck and shoulder. Remarks. She15, 2 inch lateral. 6, GV15, at the depression, same level of BL10, for headache and backside. Remarks. BL10, 1.3 inch lateral. 7, GV20 star, top of the head, for heaviness of the head, insomnia. Remarks. GV22, 23, 3 to 4 inch anterior, for rhinitis, nasal congestion. Lesson 20. Major meridian points on the back. 2. Showing additional major points of BL and She meridians. The order is location and indications with grouping. 1. She15, 2 inch lateral from GV14. She14, 3 inch lateral from T1/2. GB21, midpoint between C7 and acromion. T15, 1 inch posterior from GB21. Indications, for neck and shoulder stiff. 2. BL11 to 13, 1.5 inch lateral from T1/2, 2/3, and 3/4. Indications, stiff shoulder, and symptoms regarding thoracic cavity. 3. BL14, 15, 1.5 inch lateral from T4/5 and T5/6. Indications, cardiac problems. Remarks. BL43, 3 inch lateral from T4/5, is widely used for chronic neck and shoulder problems. 4. BL17, 1.5 inch lateral from T7/8. Indications, coughing and phlegm. 5. BL18, 19, 1.5 inch lateral from T9/10 and T10/11. Indications, mental stress and backache. 6. BL20 to 22, 1.5 inch lateral from T11/12, T12/L1, and L1/2. Indications, widely used for digestion problems. 7. BL23, 25, and 28, 1.5 inch lateral from L2/3, L4/5, and S2/3. Indications, low back pain and sciatica. Remarks. BL53 and BL54, 3 inch lateral from S2/3 and S4/5, are also used for sciatica. Lesson 21. Major meridian points, anterior aspect. 1. Showing major CV points and additional landmark points. 1. Outline of CV, conception vessel. The chi energy starts at the sexual organ part and comes out at CV1, between two private parts, and goes up along anterior midline and end at the lower jaw. Remarks. Chi energy of CV connects GV at inside the mouth and circulates endlessly, which means chi goes up along anterior midline and goes down along posterior midline. 2. Major points, with grouping according to indications. 1. CV4, 2 inch, above pubic symphysis. CV6, 1.5 inch below umbilicus. Indications, cold feet, autonomic imbalance, weak body energy, chronic sciatica. Remarks. The measurement between pubic symphysis and umbilicus is 5 inch. 2. CV8, umbilicus. CV12, 4 inch above umbilicus. Remarks. 1. Same level points of umbilicus. Key 16, 0.5 inch lateral from umbilicus. Sank 25, 2 inch lateral from umbilicus. SP15, 4 inch lateral from umbilicus. 2. The measurement 8 inch between umbilicus and xiphoid process. 3. CV14, 2 inch, below xiphoid process. CV17, level of nipples, the fourth intercostal level. Indications: autonomic imbalance according to stress from grief and worry, cardiac and breathing syndrome, lack of appetite. Lesson 22. Major meridian points, anterior aspect 2. Showing major chest and face points. 1. Chest points key 27, inferior edge of sternoclavicular joint, 2 inch lateral from CV. Saint 13, inferior edge of clavicle, and on nipple vertical line, 4 inch lateral from CV. Lu 2, depression inside edge of coracoid process, 6 inch lateral from CV. Indications: thoracic outlet syndrome, menopause, woman's syndrome. 2. Face points the third eye, Yantang, tween eyebrow. Tai Yang, depression outside of the eye. Saint 2, depression below the eye pupil. GB3, mid and superior edge of zygomatic bone. Saint 7, depression and inferior edge of zygomatic bone. Saint 8, temple, 0.5 inch, above the front hairline, and 4.5 inch lateral. Indications: fatigue of eye, nasal syndrome, facial paralysis, rejuvenescent facial care, and heaviness of head.